Alive and Well is brought to you by Pine Rest Christian Mental Health Services.
There is no doubt that experiencing a global pandemic can take a tremendous toll on your mental health. And in fact, Pine Rest it's released a study, a report that predicts a 32% increase in statewide suicide rates tied to the pandemic. And joining me now to talk a bit more about that report is Yvonne Edwards. She is Outpatient Clinical Director at Pine Rest. And I thank you, Yvonne, for being here.
Thank you for having me.
Tell me a little bit about how this could be. 32% sounds so alarming.
I'm hoping I'm wrong with it. I'm hoping that this report serves as a red flag that sets up the alarms, that we rally those resources and support that's out there to make that not be the case. How we arrived at that number is COVID-19 is brand new. We don't yet know what the mental health impact a year from now will be. So our best predictions comes from looking at some of the risk factors for suicide and mental health outcomes that are increased during this pandemic, and looking at prior pandemics, such as the SARS pandemic in Hong Kong. They did a study, and what they found is that for the 2 years following the SARS pandemic in Hong Kong, they saw a 32% rise in suicides. That's particularly concerning because of some of the differences between SARS and COVID-19. While SARS had a higher case fatality rate, a higher percentage of patients who contracted the disease and died, COVID-19 has spread more, has impacted more lives. There's a greater sense of it could be there, you could be contaminated and not know, and it has killed more people because of some of those things. Yikes. And so in some ways, the fear of COVID-19 might actually be higher. The unemployment during SARS was actually lower than what we've already experienced. They had about 8%. We've already surpassed 17% rise in unemployment. And unemployment itself is a predictor of suicide.
So what do we do about this?
I think we look at what we can do to mitigate the risk factors. So things like social isolation raises the risk of suicide attempts, and especially for teens, it can double it.
Wow.
There are ways to connect, though, while staying physically isolated.
Well,
like you and I.
Yeah.
And there's so many great apps that can help you with that. FaceTime. There's this app I use with my friend called House Party that lets you play games with them. Looking for ways to connect socially while staying at that physically safe distance becomes a life-saving intervention. Engaging in coping skills, exercising, doing hobbies, taking time to relax, taking care of your sleep. When your sleep gets disturbed, that's a potential risk of suicide as well. So really making sure we're getting good sleep and seeking help if we're having trouble sleeping. And then checking in with each other, seeing how they're doing, and not accepting answers like okay or good, because none of us are good. The distress is hitting all people. So asking how they're doing, and if you or someone else is struggling, if you're not able to relax, if those worries don't stop, if you're having trouble sleeping, and especially if you're having any thoughts that life's not worth living, that this is hopeless, difficulty functioning or getting out of bed, or thoughts of hurting yourself in some way, it is so important to seek help. We have various services available at Pine Rest, as well as other services in our community. You can do all sorts of services through Tele, which means that you don't even have to be exposed to me to get help. We can connect with you in that way. We have groups, even partial hospitalization, which is weekly, it's daily, more intensive group therapy for those who are really struggling, is available via Tele. I know that stigma can be a barrier. Being able to do it via Tele is a great option.
Yeah, do not let stigma be a barrier. And I'm going to post an article on the study, plus all of that contact information on our website at 13onyourside.com. Yvonne, thank you so much for spending some time with us. I sure do appreciate it.
Thank you so much for having me.